Hello, everyone. Good afternoon. I'm recording this on May 28th of May 28th around 3 in the afternoon. So if you're um, if you're watching this later than that, you'll kind of know why I'm referring to what I'm referring to. But um, this is the third of our sort of COVID-19 webinars, and I think I did the first one. Dr. Yasujian did the second one. This is our third one. And now that it's our third one, I'm getting a sense of what the late night talk show hosts are dealing with, and they're just kind of talking to a camera here, and there's no sort of live audience or real people to give any feedback. It is a little bit of an odd feeling, so just bear with me if it seems a little off. That's why. So today what we're going to do is I'm going to sort of basically just have a new patient seminar. If anyone has any questions, sort of if they're listening live, you have questions, you can chat them in, and my staff will show me, so I can certainly answer questions. But I'm just going to sort of go through what's a new patient seminar, the kind of questions I know we normally get. I will kind of tailor it to the COVID-19 thing because unless you've been living under a very large rock, you know that that's the only thing everyone's talking about these days. So I will kind of talk somewhat about things that are relative to obesity and bariatric surgery and COVID-19, but aside from that, also just the general bariatric surgery. So if you're listening to this, I assume either you or someone you care about is either thinking about, considering bariatric surgery, has had bariatric surgery, and so there's typical kind of questions that folks have when they're thinking about those things. So I'm going to kind of go through those things. And again, if you have any questions and you're watching this live, you can certainly send them to us. I do have a little cheat sheet here, so if I refer to it, if I'm looking away from the camera for a moment, I'm kind of looking at my little cheat sheet. So yeah, we'll start off by talking about COVID-19 and obesity. So one of the things that we've noticed, when I say we, I mean people who are on the in the trenches, so to speak, and dealing with COVID-19 day to day. In the hospital and admitting patients and taking care of them as they're ill. One of the things we've noticed is that obesity seems to be a risk factor for two things. One is just getting ending up in the hospital. So getting COVID-19 and ending up in the hospital. So as you know, many patients who get COVID-19 don't really have any symptoms. Somewhere between half and 80%, we think, really just don't even get any symptoms. But of the ones who do, a disproportionate number of them, or more than expected number of them, are obese. And then having ended up in the hospital, obesity seems to be a risk factor for the type of infection that ends up causing people to be in the ICU or even on a ventilator. So, and we don't really know why this is. I think part of it, this is kind of speculation on my part of it is just that folks who are obese have other medical problems, which we'll talk about as we go forward. Obesity causes diabetes, high blood pressure, sleep apnea, even asthma. And so those are things that can either affect your immune system or affect your breathing system, your pulmonary system, your respiratory system, and that can lead to the more aggressive version of COVID-19. So there's right now it seems that, at least in our country, in the United States, that obesity is kind of, we call it an independent risk factor. Aside from everything else, obesity seems to be something that will cause patients to get a more aggressive version of the COVID-19, that is, not the one that has symptoms, which will end up being in the hospital, and then having gotten to the hospital and being in the hospital, the type of infection that ends up putting patients in the ICU. Again, we don't really know all of the whys and wherefores there and why that really happens, but the research seems to indicate that that is the case. So if it is something, for bariatric surgery, something you're considering, that may be one of the things. Is there going to be a second wave? Will there be subsequent waves of this in the future? We don't know. But clearly, one of the main things you can do to prevent the more aggressive version of the COVID-19 is to be of a normal weight. And then the other medical problems we're going to talk about, the diabetes, high blood pressure, also can lead to a more aggressive version. So But even if you're just overweight and don't have diabetes and don't have high blood pressure, just being overweight itself seems to be an independent risk factor for COVID-19, and for reasons that we don't completely understand. So if that's something that's, that's weighing on you, that's giving you concern, that may be one of the things to, kind of put in the mix here, and when you're deciding, is this something you want to do or not? So, so that's the COVID-19 and obesity thing. And again, that, the research here is a little preliminary. We're still learning. I don't know if the final word has been written there, but it is something that seems to be the case. What's interesting is comparing the United States to China. In China, the thing that seemed to be the biggest risk factor was smokers. Apparently, I didn't realize this, apparently a fair number of people in China smoke, and that seemed to be the real risk factor for getting the more aggressive version. But in this country, obesity and diabetes seems to be the real two of the main risk factors. Okay, so that's obesity and COVID-19, which again is obviously a very, of the moment topic. Hopefully in a year or so it won't be as big a deal, but at the moment clearly it is. So that's one thing to think about. Now, other benefits to bariatric surgery. Again, if you're watching this, you're considering bariatric surgery, or someone you know is considering it. Why would you consider bariatric surgery? So, first of all, before you even consider that or discuss that, who's a candidate? So if you go to our website, you can just go to the Google search engine and type in BMI, letter B, letter M, letter I, BMI calculator. You'll have to type in your height and your weight, and it'll tell what your BMI is. If your BMI is over 40, then you are a candidate for weight loss surgery. Again, you go to our website or any bariatric website. If your BMI is less than 35, then you're not a candidate. And then between 35 and 40 is sort of a gray zone where it kind of depends on your particular medical situation. So assuming that your BMI is over 40, then you are a candidate. And, there are clearly, this has been very well researched, there are clearly health benefits to losing that weight, whether it's through bariatric surgery or not. But the most effective way to lose that weight is through bariatric surgery. And the main four medical problems that we sort of deal with in our office and that we discuss with folks really almost every day are diabetes, high blood pressure, sleep apnea, and heart disease. Those are kind of the big four of our practice. And those, if you have one of those medical problems and your BMI is over 40, the good news is we've got a very effective treatment for you, and that's called bariatric surgery. So not only does bariatric surgery help you lose the weight, which it will, but it has pretty dramatic impacts on all four of those medical problems. So we'll talk about diabetes first. There's, diabetes is one of those medical problems that clearly the risk goes up as you gain weight, and the risk goes down as you lose weight. So it's really just a direct correlation between someone's weight. And so the good news is that bariatric surgery, rates of diabetes plummet. Most patients, depending on the procedure, most patients either have complete resolution of their diabetes, as in it just completely goes away, or they're dramatically improved. So they used to be taking insulin, they no longer need insulin. They used to be taking 3 pills, now they're only taking 1. That sort of thing. So the good news is there's a very effective treatment for diabetes. That's the first one. That's probably the most dramatic one. If you are diabetic, if you know someone who's diabetic, you probably have experienced firsthand how devastating that disease can be. Circulation problems, problems with people's vision, their kidneys, nerve damage. There's a whole host of things that that diabetes causes that fortunately will get much better once you've had bariatric surgery. So that's number one. Sleep apnea. If you snore, or if you sleep with someone who snores, and they're overweight, there's a good chance that they have sleep apnea. And this is a disease that most people identify it just as snoring, but it causes a whole bunch of stresses on the body. What's happening is, when people are significantly overweight and they're snoring, and all that weight is on their chest, they're actually not getting enough oxygen into their system. And that causes a bunch of stress on the body, the heart, and many organs. And so that has a whole bunch of effects beyond just the snoring. The good news is, again, if your BMI is over 40 and you have sleep apnea, that the surgery will improve it dramatically. Probably 90 to 95% of folks, sleep apnea just goes away completely, once they've lost 50 or 100 pounds. No longer need the machine, just sleep great. And it's amazing how much energy people have once they get a good night's sleep. So that's diabetes and sleep apnea. The other two are high blood pressure and heart disease. And these are the two that are partly related to weight and partly related to genetics and family history. So they both clearly will get better with weight loss, but it's not just weight loss. So there are there's some folks who are thin who have high blood pressure and have heart disease. So it's not just the fact that it's not only the fact that someone's overweight that can cause this. There are genetic and family history factors as well. But there's no question that if you are overweight, that losing weight will reduce the risk of either one of these significantly. And it depends on the particular patient. And that's one of those things that we sort of have to, once we meet a patient individually one-on-one, we can get a better sense of how much those things will improve. But they definitely will improve, it's just a matter of how much. Unlike diabetes and sleep apnea, where there's a really dramatic improvement, heart disease and hypertension depends on the individual. Again, family history and genetics play a pretty big role there. So how much weight can someone lose? This is one of those things that when you come to the office and we meet you individually, we can have that's a discussion that has to be tailored to the individual. Depends on what your weight is, how long you've been overweight, and also, probably most importantly, which procedure you're having. There are different procedures, and they have different, we'll say, levels of effectiveness in terms of both weight loss and in terms of resolving these comorbidities, these medical problems that I've been discussing, the high blood pressure, the diabetes, sleep apnea. And so it's hard to give a one-size-fits-all. The procedure that most folks are familiar with and is what we do most commonly is called the gastric sleeve or the sleeve gastrectomy. There's a version, I believe we have a sort of animated version of that on our website. You can certainly go on YouTube and see videos of it. That is the most common procedure. Doesn't mean it's right for everyone, but it's what we do most commonly. And as a general rule, folks will lose anywhere from 50 to 60% of their excess body weight with that procedure. But again, that's something we have to, it's more of an individualized discussion when folks come into the office. So those are kind of the benefits of surgery, and those are the, if I was listening to this and considering this for myself or for someone I care about, those are the things that, those are the main four medical problems that we deal with, but there's others. Infertility can clearly be worsened by and even just primarily caused by being overweight. There's certain cancers where the risk goes up with obesity. And so not only are you at higher risk for certain cancers with obesity, but if you get that cancer, you have a worse prognosis. So losing weight not only reduces your risk of getting the cancer in the first place, but should you get the cancer, you have a better prognosis if your weight is lower. So there's certain cancers, polycystic ovarian syndrome, which is another cause of infertility. This is another, another medical problem that we see pretty frequently in our practice that has definitely improved with obesity. It was improved with bariatric surgery and with weight loss. So again, there's a whole host of medical issues that are improved pretty dramatically with weight loss and with bariatric surgery. So, it's interesting, most surgeries only kind of focus on and deal with a single problem. So for instance, someone has a hernia, they get the hernia fixed. If someone has a gallbladder problem, we take out their gallbladder. If they have appendicitis, we take out the appendix. And so one surgery kind of treats one problem, so to speak. The interesting thing about bariatric surgery is, this one operation cures many problems. Again, diabetes, high blood pressure, sleep apnea, improves heart disease, hypertension, and the the subject of the day, reduces your risk of getting the corona, and then reduces your risk, should you get coronavirus, reduces the risk of getting the more serious version. So, in summary, I would say there's a whole bunch of medical problems that are improved dramatically with bariatric surgery. So even though we sort of talk about weight, and obviously we focus on weight, and every time you come to the office, we will weigh you, really it's about the medical issues and improving those medical issues. So that's we'll say that will improve the length of your life and, have you live longer. Obviously, someone, once their diabetes goes away, once their sleep apnea goes away, once their blood pressure is improved, it's very likely that person is going to live a longer life. We'll say the quantity of life, the amount of life you have. But there's many quality of life issues where just people feel better about themselves, independent of how long they live. So they just don't have back pain, don't have joint pain. They can, play with their children and their grandchildren. These little quality of life issues that, honestly, I think most patients probably, focus on those things as much as on the medical things, because it affects them on a day-to-day basis. And so both in terms of quality of life and quantity of life, bariatric surgery clearly has pretty dramatic benefits. So another topic I want to mention or kind of discuss is some misconceptions. So there's, usually, as I said, this is kind of a version of a new patient seminar, and there's always kind of questions folks have or sort of things they've heard about bariatric surgery that frankly are just either just flat out wrong or not totally accurate. So since no one's here really asking those questions, I'm gonna just sort of run through them because I suspect it's something that many folks are either in the back of their mind or thinking right now or have heard in the past. So let me just address a couple of those. So first one would be, what about weight regain? And I'm always, basically every patient asks about that. How likely is it going to regain weight? Or actually, or the opposite side, what's the risk of losing too much weight? Either one of those things I get pretty frequently. So we'll deal with the issue of losing too much weight first. It's very, very, very rare I see a patient who's lost too much weight. I've been doing bariatric surgery since 2003. Could probably count on one hand the number of patients who legitimately actually lost too much weight. So it's not, strictly speaking, impossible, but it's something that we see maybe once every several years. It's incredibly unlikely. I'd also mention that now that we mostly do the sleeve, I don't think I've ever seen a sleeve patient actually lost too much weight. I'm just trying to think, but I don't think I've ever seen a sleeve patient actually lost too much weight. Not to say it can't happen, I guess anything can happen, but it would be incredibly unlikely. But what about weight regain? So the first thing I'll say is, no surgery, no treatment, no medical treatment, whether it's a surgical treatment or just, medicine, nothing's 100% effective, 100% of the time. That's not possible, that's not likely, that's not realistic. So anyone who's promising you or guaranteeing you that you're going to be 100% successful is just not being honest, quite frankly. So nothing's 100% successful. But there's no question that bariatric surgery is the most successful treatment for morbid obesity. By the way, morbid obesity just means your BMI is over 40. At the beginning I mentioned the BMI, and so BMI over 40, in medical terms, we call that morbid obesity. There's no question bariatric surgery is the most effective treatment for folks who are morbidly obese. Doesn't mean it's 100% successful, but it's the most effective treatment. So what I generally tell folks is, with non-surgical treatments, can you lose 100 pounds? It's possible. It's not impossible. It's not common. It's pretty rare, actually, but it's not impossible. The number I generally tell folks is, about 1 out of 20 people can actually lose 100 pounds without surgery. So it's not, strictly speaking, impossible, but it's not very likely. Whereas, with bariatric surgery, it's pretty common. Many of our patients will lose 100 pounds. Now, what's the risk that they can regain some of that weight? Most patients will regain some, usually between 5 and 10%, I say is a common thing that we see. So most patients lose weight in the first 12 to 18 months, and usually the lowest weight is somewhere anywhere from 12 to 18 months after the surgery. And then Most patients will regain 5 or 10% of 5 to 10% of the weight from that lowest point. That's fairly typical, but to gain a significant amount of weight back is pretty unusual. Again, not impossible, can definitely happen, but not typical. And one of the reasons we have basically a lifetime follow-up program is to catch folks if they're sort of going off off the plan a little bit, off the rails, and looks like the weight gain is a little more than we would expect. Get folks back into the program and sort of back on the program so that they maintain the weight loss that they initially achieved. So weight regain not impossible, but definitely not typical. And if your BMI is over 40, there's no question the most effective treatment is bariatric surgery. How dangerous is the surgery? That's a reasonable question. Anyone who's contemplating surgery. I mean, if I was thinking about surgery for myself, whether it was bariatric or some other surgery, I clearly want to know, how risky is this thing? Do I need to do this? Is it ultimately going to benefit me? And is doing the surgery less risky than not doing the surgery? And actually, with bariatric surgery, the answer is a clear yes. It is definitely less risky to have surgery than to not have surgery. By that I mean, if your BMI is over 40 and you either have diabetes or at high risk for diabetes, or you have sleep apnea or at high risk for sleep apnea, or you have heart disease and now at high risk for heart disease, or have high blood pressure or at high risk for high blood pressure, all of those things will affect how long you live. So if your BMI is over 40, there's no question. This has been very well studied. There's been several studies published in the New England Journal of Medicine and other pretty prestigious journals about, do patients live longer if they've had bariatric surgery or they don't have bariatric surgery? And the answer is they definitely live longer having had the surgery, because the surgery helps them lose the weight, helps their diabetes get better, their sleep apnea get better, and all these medical problems improve, and that helps patients live longer. So there's no question, you will live longer if you have surgery. So there's just no question about that. The research there is quite compelling, quite solid. So when patients, ask, is the surgery dangerous? Sure, surgery has risks. And if you come to our office, we'll have a very lengthy discussion with you about different risks of the surgery. But there's no question that even with the risk of the surgery, you will ultimately live longer if you have surgery than if you don't, because of all the improvement in medical conditions and from just the weight loss itself. So although there is risk with surgery, there's no question that overall your life will be longer if you have surgery than if you don't. There's very clear research there. Another question I get not infrequently, is surgery a cop-out? Or kind of worse to that effect, and taking the easy way out. My wife, my coworker, my spouse, my friends, they think I'm copping out. And my only answer to that is that, again, is it possible to lose 100 pounds without surgery? Yes, it's possible. It doesn't violate laws of physics, so to speak, but it's very unlikely. Very few people can lose 100 pounds without surgery via non-surgical methods. And so, I always tell patients, if you're not ready to do surgery, if you think you can do this without surgery, then go for it. If you're the 1 in 20 you can lose the weight without surgery, that's great. You should go for it, and if you are, I'll be cheering you on the whole way. But if it's just not realistic for you for whatever reason, given your lifestyle, given your genes, given your medical history, given the medications you're taking, whatever your particular situation is, then the surgery is the way to go. It's clearly the most effective treatment for someone who's morbidly obese. And again, morbidly obese, roughly speaking, means you're at least 100 pounds above what your weight should be for your height. So, in no way, shape, or form is it a cop-out. And actually, by the time most folks get to my office, they've tried many things, and so they're ready. But if you're getting that kind of feedback from your community, you need to let them know that it's not this thing where obesity is considered some sort of personal failing, that conversation is just not accurate. It's not accurate, and it doesn't. It's just not consistent with the research that we have now about the problem of morbid obesity. Another question I get is about vitamin deficiency. So, one of the things that I kind of alluded to this earlier, is once you've had surgery with us, it's basically a lifetime program. So there's obviously pretty intense follow-up in the first few months right after surgery, but then there's less intense follow-up as folks get further and further out. But even once you're a year out from surgery, we still do once a year follow-up to two things: make sure that that you're kind of following the program, and that there's no weight regain, but also to monitor vitamin levels, certain other blood tests that we follow to make sure that things are going the way they're supposed to be going. And so as long as you're following the program, I've never, again, been doing this surgery for close to 20 years now, I've never really seen a real significant vitamin deficiency in someone who is following up, doing what we recommended they do. Now, I have seen a few patients where they kind of disappeared for 4 or 5 years, who then came back with a problem. So, if you sort of fall off the rails a little bit, certainly problems can develop. But as long as you're following our program, just coming in once a year, get some blood work done, I've never seen anyone who had any serious problems as long as they were following that protocol. So while vitamin deficiencies are theoretically possible, it's not something I've seen really at all, and it's something I've seen very rarely, and I've never seen it at all in someone who's following the recommended protocol. So I think those are most of the questions that I typically get. And it looks like we're coming up on about 30 minutes. So I don't know if anyone's still hanging in with me here after 30 minutes. But if you are, I appreciate it. Thank you very much. And until next time, we'll see you soon. Oh, one last thing. So we're going to be back in the office pretty much with regular office hours starting in June. Following all the protocols, we'll have masks, we're cleaning the rooms, we're doing all the things that are kind of recommended by the CDC to make sure that everything's done safely and properly. But yeah, we'll be back in the office more or less in June. Okay, folks, take care. Bye-bye.